Dooley Noted, 12/14/2014. Hi, I'm Dr. Kathy Dooley. I'm here with the amazing Anna Folkmer. Miss Anna, a dancer, very well-trained dancer. She's also my assistant instructor for Immaculate Dissection, a new seminar series that's going to be premiering in January. And we don't talk about in Immaculate Dissection until later about the foot movement, but I had a lot of people request to me about giving a drill for inversion and eversion of the calcaneus. So what ends up happening in a lot of dancers, and Anna, you can speak to this more, is that you were coached to supinate the foot. Can you tell them a little bit about that?
Just for the aesthetics of the higher arch and to not allow the arches to collapse.
Yeah, so the collapsing of the arch is actually a normal thing that happens during pronation. And Anna's had it driven into her that pronation is a bad thing. It's not a bad thing. And ironically, even though she has been taught to supinate or put the weight onto the outside of the foot and create that arch, you don't do it so great on one of your feet. At Anatomy in Motion, a really nice seminar series, they showed a really good palpation of the talus, where you actually put your fingers here on each side, in between the malleoli, these little bones that jut out, and you're actually feeling for talar movement. The subtalar joint is often ignored in a lot of palpation. The subtalar joint is the talus, this domed bone here that meets the heel, or calcaneus. So it's a calcaneal joint, or subtalar joint. This joint has to be able to pronate for you when the leg is forward during gait. So it's really important for walking. And pronation is normal. It's natural. It's natural for your arch to collapse during a suspension phase of gait where your leg is forward. So what we can do is test to see if you can actually rotate. So you can put your fingers in between each talus, or on the talus, in between each malleoli, and then if you rotate to the left, Anna, her left foot should be supinating, her right foot should be pronating, and then rotate to the right. You see her foot kind of falls into pronation here on the left side. And then if you're focusing on the right side now, rotate to the left. And she has a really hard time being able to fully pronate on this foot here, and then rotate to the right. She has had it trained in her to supinate so much that she kind of falls into pronation. So if you're trying to help someone to supinate and pronate, there's a really nice drill you can do in half kneeling. So Anna, if you can go onto one foot here, and I'm going to guide you through this, put one leg forward, one leg back, and you can actually coach the foot to be able to supinate and pronate. So if we can come in close here, right here. So Anna, what I'm going to have you do is keep 3 points of contact on the ground. One here, and one here. And what I want you to do is keep the balls of your first toe, your fifth toe, and your heel on the ground. And I want you to lean your knee forward and actually rotate your tibia forward. And I'm going to try to block your hip with my arm. Okay, so go ahead. You can see it's very stiff. Yeah. It doesn't really want to internally rotate. This is pronation, where the arch should collapse, and she has a really tough time with that. So you can also rotate it out as you sit back, and that's going to be supination. Easier for you, right? So depending on the patient, some people pronate really well, some people supinate really well. This is a really nice corrective that you can do, and I'm going to give you some assistance here. I'm going to use my fingers like wedges. Okay. You can actually use wedges to do this, but we're just going to use my fingers. And then rotate your knee forward. I want you to put your hands physically on your tibia and rotate it inwards like this as you kneel forward. Good. Good. And come back and then twist it in external rotation. Keep those points of contact on the ground. And again, rotate in. You see how hard it is for you to rotate there. Good. So you might need some assistance, and I can help you out with that. Go ahead. So go see a therapist if you can't actually do this movement. They can actually help you with this. But the homework is really lovely. You can do this half kneeling stretch. And if you feel like you're using the hip too much, you can do it against a wall. I'm going to be your wall. That way you're forcing the tibia to move instead of the femur. Good. But anytime anything hurts, just go see your therapist. Make sure that you don't overdo it. But this is a movement that you don't have that you might need. Pronation is important, but some people it's supination, so the sit back part of being able to maintain an arch can be very challenging for a lot of people. Don't buy the whole hype that pronation is bad for you. It's actually pretty good for you and you need it, but it's been coached out of her with her dance. So something to think about. If you're having trouble keeping the points of contact on the ground, I use my fingers as wedges, but you can actually use a book. You can use quarters. You can take coins to the bottom of your foot in the 3 points of contact. Triangles are pretty stable, so you want this triangle of stability on the ground when you're supinating and when you're pronating, for the most part, through especially 2 major phases of gait, suspension and propulsion. So This can be trained, this can be helped. I do these corrections right before I squat, before I deadlift, or before I go for a steady walking in New York. It's really, really helpful to promote pronation and supination of the foot. Okay. Dr. Kathy Dooley, and thank you so much for being my guinea pig. Yes, try this out and see if you like it. Dr. Kathy Dooley, I'll see you next time.